Hi everyone, it's Ashley here. Today I'm going to go through Medical Director, at least how I use it in everyday practice. So if you're not a GP, you probably should tune out. And if you're not a GP that uses Medical Director, you should probably tune out as well. So apparently Medical Director is used by about 40% of GPs, so that's a fair amount of us. So probably around 15 to 20,000. I got the idea for this video because we've got 2 GPT-1 registrars starting next year, and I thought it'd be easier just to sit them in the room and loop this video for a couple of hours rather than actually going through it with them, rinse and repeat for the next registrars. So this isn't really a review of Medical Director. Everyone knows best practice is far superior. So if you are stuck with Medical Director, just be thankful that you're not on ZMed. So this video is really pitched to new registrars or maybe doctors who are new to Medical Director. If you have been using Medical Director for a while, maybe let me know on some of the things that you find useful in your day-to-day practice as well. I don't think my way is necessarily the best way of using Medical Director, it's just what works for me, and different practices might require you to use it in different ways as well. I might just add this video is probably best viewed on a laptop or a desktop computer. It might be a bit hard to see the details on a smartphone screen. Anyway, so let's get started. Did that work? Before we jump into the patient's file, there's a few things on setup that can really make things easier. Sorting them out once and then you don't have to worry about it later on. So if we go up to tools and options, and that'll give us a whole bunch of ways to customize how you use Medical Director. I'm not going to go through all of them, I'm just going to go through the ones that I think are the most useful. Starting in the general tab, I don't think I really changed too much on here. Now you can customize the medical certificate button in Medical Director, so make sure that links to the right letter in your practice. So Medical Director initially started off as a prescribing program, so I think that's why there's so many options in this tab. The only ones generally that I change here would be save in medical past history and pre-select save as reason for contact, just because most of the time it doesn't correlate with what you want, and it's easy enough to manually select that if you need to. Everything else I just leave, I think. We move on to progress notes. Here there's a bit of customization. The only ones that I change are save in past medical history, so make sure that's unticked. Otherwise you might end up with lots of ERTs, immunisations listed in the past medical history, which is a little bit messy. Everything else I keep the same. So the next one I'll go through is investigations. Tab up here, practice and lists. I don't really have much relevance to us clinically. So investigations here, you can select the preferred lab if you've got a whole list of them. Usually one template would fit multiple different lab companies. They usually have the same form anyway. The only option I generally change from the default would be save clinical details in progress notes. So usually that's unchecked, but I check that. It reminds me why I've ordered those tests in the first place. Down the bottom here you can set up pathology favorites, so you can select up to 10 frequently used pathology requests. If you need to group them, you need to write multiple ones into each text box. So for example, if you want TFTs plus something else, you can type in, just add as many on as you like. That's probably how you would set up your pregnancy blood tests. You can't group any under a single label. So a little bit of a GP joke there. That's going to take a lot of work to put back in. I can't even remember what my original favourites are now. Okay, so drug patient support, I turn most of those off. The rest of these tabs I tend to just leave. There's nothing that relevant to your clinical day-to-day practice on that. Going on to prompts, these ones I tend to leave. I remove the Up Pathology and physical activity ones because I don't think they're that relevant most of the time. You can switch all the prompts off if you're really sick of the pop-ups. Find that after a while you just tend to ignore them anyways. An arguably better way of organising your preventative health checks and chronic disease management is with something like Doctor's Control Panel, which is quite a useful third-party add-on for medical director and best practice. I'll put a link in the description if you want to check it out. So the clinical tab here, I just tend to leave as the default mostly. At the bottom, yeah, the blood pressure and entry has always been annoying, but it's something I'm used to now, so I just leave this unticked. If there was one option I had to select if I was starting medical director over again, it would probably be save on close. I think that would probably be the most useful one. My cursor is stuck. History and examination tabs, I don't really use this. I feel like it complicates the progress notes when you use this. So for me, it doesn't really serve any purpose, so we just leave them. And that should be it, I think. It's a bit of a whirlwind setup there. Feel free to go back and check things out. So we'll click save. Hopefully my cursor comes back, and it does not. Oh God, Windows 10, you're killing me. Keep an eye out for part 2 of this video, where I'll go through a couple of different patient scenarios. Hit like if you enjoyed this video, subscribe to see more, and I'll see you next time.